Good afternoon, everyone. We'd like to thank you for joining us on today's webinar, Trump, the Election, and the Future of the Affordable Care Act. This webinar is designed to provide you with some insights on what you can expect related to healthcare in the U.S. under a Trump administration. I'm Jillian Bateman, ESA Director of Marketing, and I will help to facilitate the webinar today. Before we get started, I would like to cover a few housekeeping notes. All callers will be muted for the duration of the webinar. Please be sure to use your question log in the sidebar panel to submit questions, as we will carve out time at the end of this presentation for a question and answer segment. Additionally, a recording of this webinar will be sent out after your call for your convenience. It will also be available at esaweb.org. Now, I would like to introduce Seth Denson. Seth is the president and co-founder of GDP Advisors, an international consulting firm specializing in the areas of human capital and risk management. For nearly 2 decades, Denson has dedicated his vocational life to the creation and ongoing management of innovative solutions surrounding human capital, recruitment, and the retention of talent, and managing the risks found within all aspects of business management. He and his team have created strategies yielding significant reductions in the overall expense and exposure of their clients' portfolios, impacting growth, direction, and profits. His firm consults for more than 850 companies throughout 9 countries. He has extensive experience in data analytics, compliance, underwriting, and benefits and risk administration. He is a contributor to a number of national publications and speaks throughout the U.S. on benefits and risk management topics. In addition to his role at GDP Advisors, Seth serves as an advisor to a number of private equity and VC firms and is a board member of Paradigm Holdings. ESA partnered with Seth and GDP Advisors to bring you the industry-specific Security America RRG General Liability and E&O insurance program, but also now offering a complete line of additional insurance solutions under the ESA Insurance Solutions brand. This exciting new offering for ESA members includes workers' comp, commercial auto, property insurance, and health insurance plans. Seth, I'll now turn it over to you to talk to us about how this Trump administration is going to affect the future of healthcare and security businesses.
I appreciate that, and thank you everybody for being on the call today. That's an interesting point. We don't really know. So into the conference call, right? I'm kidding. No, it was interesting in the moments that followed what can be, regardless of your political opinion, an unprecedented election season. I actually remember sitting. I actually waited and stayed up to kind of see what the final result was, and I wrote some notes following the election, and that's a lot of what I'll share with you today. But what's interesting was I went back and I compared those notes to what I wrote when the Affordable Care Act was actually passed, and a lot of similarities in kind of just the unexpected and really what was going to happen in the unknown. So before we really get into the future of the ACA and how Trump administration might impact that, we're gonna go back, and I'm always a proponent of finding out where we've been, tells us where we are, and oftentimes can be an indicator for where we're going. I was a history major in college. And so a lot of what I do relates to historical events, and when I'm looking at the overall analytics of things and statistics of things, we look at that data from the past to really help give us predictors of the future. And so we're gonna walk through those things today. One of the things I want to just say on the front end, this is going to be an extremely non-political discussion. Okay, my goal by the end of today's conversation is that you don't know which side I lean politically and what opinions I might have. I'm going to start off by saying, with regards to the Affordable Care Act, there are some very good parts of the law. I was a skeptic at the beginning, however, not for political reasons, just for reality reasons. My background is in underwriting, and I've been almost 20 years in the health insurance business. And the one concern I had of the Affordable Care Act from the beginning was that it was more health insurance reform than it was health care reform. And the healthcare system is really a three-legged stool with the health care providers as one leg, the health insurance companies as another, and then the actual patients, the users, is the third leg. And you have to address all three of those areas to really impact change. And the Affordable Care Act really only did one of those areas, and that was the health insurance side. So we're going to walk through this today. Like I said, we will not be political on this. I will talk about some pros and cons, and then we'll talk about what we foresee in the near future as the first few months of the Trump administration rolls out. So really, let's start by really understanding the past. Where have we been? Okay, and I always show this number, and this is an interesting number because I got into this business in 1999. I sold my first health insurance policy in 1999, and that health insurance policy was $46. That was the first health insurance policy I wrote. Now, for those of you that pay for health insurance that are on this call, you would probably be willing to do a lot to get a $46 premium. That's pretty unheard of. And I'll tell you that this was not a bad plan. This is with what is now United Healthcare, the carrier at the time. It was a PPO plan with a $1,000 deductible on a 26-year-old male. So $46, pretty unheard of today. And actually, from that point on, this is what happened. So following that $46 premium, you see 1999, that was the year I sold that policy. Over the next 10 years, the health insurance cost went up over 131%. The inflation rate during that same time period was 28%, and workers' earnings were only 38%. So what we have seen over the last decade, and in reality, in the decade that has followed, or the first, more than half of that decade, is that same trajectory. We actually saw workers' earnings plateau a little bit after the 2008-2009 recession, and so as did inflation. So while those plateaued, health insurance premiums did not, and so the gap has actually widened even more in that time period. And the reality is the cost of what we are paying for health care has gone up, while the value of what we have gotten has gone down. And so in that decade of increased costs, the market really tried to react, and they tried to react in a number of ways. We call it the acronym period, in that you had things like HMOs and PPOs and indemnity plans, but then they started introducing things like health savings accounts and health reimbursement accounts. The George W. Bush administration actually did a lot to try to further health savings accounts by doing things like allowing not only the tax savings on them, increasing the levels in which people could participate, but also doing things like allowing for over-the-counter medications and certain other drugs to be covered under HSAs, and the expansion of tax savings benefits under health savings accounts. Health reimbursement accounts work a lot like HSAs. It's just that those are employer-based funds. And so those were what were attempted to be solutions to the ever-growing increased cost over that decade. And while we saw some curbing in the first couple of years of HSAs, it's interesting. HSAs in their first year of full rollout showed an anticipated savings of almost 30%. That's a big change. And what happened, though, over the next couple of years was, because of that so significant savings of HSAs, the employer market responded by widely implementing them and taking what they were spending in premiums and instead investing it in employees' HSAs. Well, that's a great thing for employees, but it did nothing to impact health care or actual utilization, because now employees who had a high deductible had HSA funding to cover that high deductible. So the whole idea of what we called consumer-driven health care, that was going to be the big driver of health savings accounts, really didn't impact them much because of the overall premium savings. So the good actually created the continuance of the bad. So that brought us to where we really are today, the present, because 2008, 2009, we started talking about this thing called the Affordable Care Act. We started talking about healthcare reform and what the new administration was going to do to try to impact what was going on in the healthcare market. And something had to be done. Okay, there is no way to continue the trajectory that we were on without changing something. Now we can argue one side or the other on what changes would have worked better. Monday morning quarterbacking is always easy, or at least easier than actually getting in the trenches. But the reality is something did have to change. And what changed? The Affordable Care Act, signed into law on March 23rd of 2010, without one single Republican legislator voting for it. For those of you that remember that time period, there was an original thought. Scott Brown was the, after Teddy Kennedy had passed away, who was this longtime senator from Massachusetts, Scott Brown was appointed by a Republican governor to take his place, and kind of came in to be the 50th vote, so to speak, stopping the Affordable Care Act. Well, then Congress pressed forward prior to him coming aboard with a process called reconciliation, pushed the bill through. It was signed into law on March 23rd, 2010, and over the next 5 to 6 years, certain components would be rolled out over time. The idea of the Affordable Care Act was really fourfold. Rein in big insurance. The idea that insurance companies make too much money. Their fiduciary responsibility is to their shareholder, not to the patients in which they are supposed to be paying for claims. To improve plan designs, right? A big part of the law was to say, hey, we're gonna restrict an insurance company's ability to put high deductibles into plans and to cap maximum costs at a certain level per year. The goal was, because of the employee and employer mandates, that it would overall reduce costs because it would get more people into the marketplace, thus create a higher level of utilization of healthier people, bringing down the cost for the less healthy that were currently in the market. And then it was going to increase competition and choice, because why not? You know, the idea was that with there being a mandate, there would be more insurance companies that would step up to the plate, recognizing that everybody had to have health insurance. So why not, in a capitalist society, make it the law that everybody has to have it, and then more businesses can start up offering solutions? Well, that was great in theory, but here's what really happened. This is March 23rd, 2010. This is Anthem's stock price. Anthem is the largest owner of Blue Cross Blue Shield throughout the United States. And in the 5 years following the passage of the Affordable Care Act, their stock price went up 151%. Aetna, 214%. Humana, 241%. See a pattern here? United Healthcare, 247%. So the idea, let me not forget Cigna, who had the highest stock price increase, 248%. So this idea that we were going to rein in big insurance companies, right? We're going to change the way that things happen. We're going to improve plan designs, reduce costs, increase competition and choice. It didn't really pan out that way. Why? Because of the way the law was written. The law was written that insurance companies had to use a certain dollar amount to pay for claims, thus restricting the amount of profit that they could generate on any given dollar. Now, the hurdle or the issue in how the law was written was that restriction was not a dollar amount, rather a percentage amount. So if you were a large group, that was classified as a group over 50 lives, later reclassified as groups over 100 lives. The insurance companies had to spend 85 cents of every dollar they collected on your claims, which restricted their ability to generate a profit to overhead expenses less 15%. Right? Sounds good. You know, some people on one side of capitalism could say, why are we restricting private entities' ability to turn a profit? Don't worry. Private entities know how to manage these things, and we're going to talk about that here in a second. Okay? But the idea was to restrict the cost and to really make sure that insurance companies had the patient's best interests at heart. Well, here's the hurdle. It was based on a percentage, not a dollar amount. So if you were on the strategic financial team of United Healthcare or Aetna or Anthem or Cigna, and you're looking at this new law and saying, hey, the government is going to restrict us to only to use 85 cents of every dollar we collect on claims, are you wanting to collect more or less dollars? Do you want 15% of $1 million? or 15% of $1 billion, right? So if you were a shareholder, you were pretty pleased with the overall results that people saw, as a shareholder, that these insurance companies had. Because the reality is, the way the law was written, it was not written to impact health care costs. And what you saw over the course of the 5 years was, because these insurance companies had all of this extra cash because of the increase in premiums year over year, they started buying each other up and merging. So we actually saw consolidation, not increased competition, not increased choice. And that was really what's happened. So the impact of the ACA, premiums just in this last year were up 26%. Deductibles, 32%. Remember, the whole goal was to reduce the deductibles and improve choice. Well, there are now, in any given market, only 4 major health insurance carriers, if that. And what's happened is those insurance carriers have reduced the plans that they're offering, thus controlling the access to care more effectively. The people that have won from this are insurance companies, and they were who was supposed to be reformed by this law. Now, I would be remiss if I didn't talk about the positives, though. There are positives of the ACA. It's not all doom and gloom. There are 22 million people approximately in the United States that have health insurance today that would not have had health insurance had it not been for the Affordable Care Act. Pre-existing conditions had plagued persons with issues trying to get health insurance for years, in that insurance companies could exclude medical conditions on any policy. Well, those were outlawed under the ACA. Again, you can make an argument to both sides of, well, yes, if you outlaw pre-existing conditions, which is the ability for the insurance company to control its outflow of cash, then they're going to have to collect more. And that was the argument that insurance companies made to justify their increases in cost over the last few years. Guarantee issuance, right? You couldn't be denied coverage. Everybody could get it, okay? And then extended coverage for children. Following the 2008-2009 recession, more kids that were coming out of college had less opportunity to find jobs, and thus had to stay on their parents' plan. The Affordable Care Act offered them an avenue to do that, because in years prior, the standard rule was age 19 up to a higher age, but only for kids that were full-time students. So the law just wiped that away and said age 26 regardless. They could even be married and be on your plan, okay? So, again, those could be construed as positives. There are absolutely positives in that. In 20 years in this business, I've had all too many not fun conversations with people with pre-existing conditions prior to the ACA, and people that were denied coverage or canceled for health conditions, which is really a tragic conversation to have. So what happens from here, right? So we spent the first 20 minutes of the conversation talking about where we've been and where we are. Let's take a few minutes and really talk about the future. Now, here's the concern, okay? And this is my disclaimer as we go to this next section of the presentation. I don't have a crystal ball, and nobody does. I would even argue that the new administration that will be coming into power in January doesn't have a crystal ball. And so, had the Democratic candidate won the election, we would probably have a clearer crystal ball of what would happen to the Affordable Care Act. There were talks about a simultaneous public and private system working together, similar to what Germany has. But we really don't know what a President Trump is going to do, because we really don't have any political experience of his to glean from. We actually have statements made throughout the course of history from President-elect Trump, supporting everything from a single-payer system to a public system to a private system to obviously repealing and replacing the Affordable Care Act. The day after the election, it was interesting. Our office, the phone in our office was ringing. And there were employers who were jubilant, and there were employers who were distraught over what had just happened in the election. Some even went so far as to call to say they wanted to cancel their health insurance for their employees because now that Trump was going to be the president, there would be no more Affordable Care Act. my father has a saying. I grew up in West Texas. My father has a saying: it's hard to put toothpaste back in tubes. And that statement has never been more true than it will be when it comes to the Affordable Care Act. And here's why. The Republicans may have won the presidential office, as well as the maintained control of both the House and Senate, but they lack what's called a supermajority. And a supermajority is where in the Senate things can't be filibustered. And so this being the Affordable Care Act, the staple achievement of the Obama administration, we could all but guarantee that the Democrats will do their best to filibuster any chance of a complete repeal and replace, which leaves really a Republican-held Senate and Congress the only option of making changes to be through what's called reconciliation. I mentioned that earlier. And that's really a budgetary process to defund certain aspects of laws. Well, the problem is the Affordable Care Act was written that if you defund one portion, the rest of it becomes very unstable and hard to manage. And so that's going to be a hurdle within the legislative branch. The second part is that while President-elect Trump has claimed to not be a politician, he most certainly is one now. And repealing or taking away health insurance from 22 million people, the majority of which are of voting age, is probably not going to be the best political move as your first action as president. And then third and finally, and this is the thing that hasn't really been talked about in the media much, but I've been saying it since the day after the election. I showed you earlier the stock prices of all of the major health insurance carriers. The federal government does not issue health insurance policies, and it's highly unlikely that anybody in a Republican position of power is going to recommend any solution that includes the government getting into the health insurance business. And so there will continue to have to rely on the private sector for health insurance. And private sector health insurance companies have done really, really well under the Affordable Care Act. And so don't just expect them to change overnight. And beyond that, and this is the other thing I want to mention, health insurance, while it can be regulated by the federal government, is still overseen by each of the 50 states. So each of the 50 states has their own Department of Insurance. So for an insurance company, I'll use Texas as an example where I live. For an insurance company to roll out a plan design in the state of Texas, they first have to create it, make sure it fulfills all of the legal requirements both of the state and federal government. They have to submit it for approval by the Texas Department of Insurance. It has to then get its rubber stamp. Then they have to rate it, and then those rates then also have to be approved by the state. And then they can ultimately market it and bring it to the market for implementation. That process is no shorter than 18 months. And even if it were as little as 12 months, it would be very difficult to unravel what is there and then implement something new. So this idea that we would repeal and replace Obamacare in the first 100 days of a Trump administration just really isn't a realistic one. While there may be votes on it, it's highly likely that they would be filibustered. And even if not, let's just kind of say that it was repealed in the first 100 days. The actual execution of that repeal and replacement would not happen for some time, just because the market cannot react in that amount of time. Look at the Affordable Care Act. It took almost 5 years to roll out all of the various components. And there are still some components that haven't been rolled out, that are slated to be rolled out in 2017 and 2018 and beyond. So this idea that in the first 100 days this whole marketplace is going to change is really not a realistic one. And so as we kind of think to the future, what could it be replaced with? Well, we got an idea of what the Republicans would replace the Affordable Care Act with a bill that they actually passed in the House and the Senate in 2015, sent it to the President, which was ultimately vetoed by President Obama. But even that law, which had a lot of similar components to the Affordable Care Act, from no pre-existing conditions and things like that, that law had a 2-year span before it would even begun to be rolled out. So had it passed in 2015, it would be well into 2017 and most likely 2018 before the law really was going to be rolled out. And so given that that is probably the best trajectory for what the Republicans will try to replace the Affordable Care Act with in any capacity, we can expect that it will be some time. Now, the other thing I will tell you too, and I made this statement again, and this is a personal statement. There's nothing specific about this outside of just call me an industry insider, but I made this statement the day after the election, prior to President-elect Trump meeting with President Obama for the first time, that there would be a numerous attempts to make deals prior to the new administration coming into power. For this reason, as I mentioned earlier, this is the biggest achievement of the Obama administration. And so they're not going to want it to go away. They don't want it to actually even be repealed. I think that there is probably an understanding that many aspects of the Affordable Care Act will have to change, but what the current administration, in my opinion, is most likely doing is trying to recognize that even if it does change, let's try to keep many of the components, and if at all possible, not change the law, just repair it or change it. And we saw that actually right after the first meeting between President-elect Trump and President Obama, when following that hour-and-a-half meeting, President-elect Trump came out and immediately started talking about some of the advantages of the Affordable Care Act. So, you know, that was something that I had stated the day before that meeting had happened, and it sure showed to be true following that. So, if you're following my batting average, I'm 1 for like 200. So. The other thing I will say is that there have been 51 changes to the Affordable Care Act so far. So since March 23rd, 2010, the day it was implemented, there have been not only insurance companies, but health care providers, all looking at this saying, yeah, things continue to need to change, and we've seen 51 of those so far. So what will stay and what will go? That's really the big question, and these are the things that we don't have a clear crystal ball on. So what's going to happen? What's going to change? What's going to stay the same? Will we still have pre-existing condition or no pre-existing conditions? Kids on their parents' plan. What about the employer mandate and the employee mandate? Those are hot buttons for the Republican Party that they've been fighting against. But the problem is, if you strip those things out, how does the pre-existing condition clause stay in? Because you've now harnessed the insurance companies with assuming liabilities on claims that may have already occurred or be in the process of occurring. So these are the questions that are going to have to be sorted out. These are the things that they will have to address as they do whatever they do to change the system. Do we move to a public payer system? You know, again, with all political opinions aside, there are nationalities that do it well, that they have a public and a private system, not a public-only system. Those have actually struggled in most countries economically. But when they have a public and a private system that is structured appropriately, Germany again is a good case for that. It's done fairly well, and it's curbed the cost of health care because the state is managing a health care side while in competition with the private sector. And so will we see that? It's highly unlikely, at least in the short term, that we would see that, just given that Republicans control both houses and the executive branch, but it could happen. And had the Democratic Party won the election, I would tell you it was a very high possibility that would happen. And then the question is, are we just going to go back to the way things were? Well, you saw what happened. I mean, we showed you that in the first 5 minutes of the presentation what was happening before the Affordable Care Act. So I really hope we don't go back to the way things were because that wasn't working either. Change does need to happen. But I mentioned the 3 stools of the expense side of healthcare in the United States. That's the actual healthcare industry, the doctors and hospitals and providers, the health insurance industry. Okay, and then finally, the end user, you and me. Until we become better consumers and we start changing the way and demanding a change in the way that we access care, we can anticipate very little from happening. You know, Health and Human Services sent out, they did a marketing campaign about 5 years ago. I thought it was a genius marketing campaign. in that, and I'm trying to remember the commercial. I wish I had a copy of it, but it was somebody going and they were buying, I think it was a car, and they were asking all these questions about how much horsepower and what's the gas mileage and what is the the reliability of the vehicle and everything from cup holders to colors to everything. They're asking tons of questions, and then they fast forward to the same person in their doctor's office, and the doctor's asking, "Do you have any questions?" And the answer was, "Nope." We have got to become a society more involved in the day-to-day aspects of our care, a more educated society of what is going on in the healthcare sphere, because until we are left to whatever the healthcare and health insurance industry make the healthcare system. So 3 things that employers really need to know as we look to the future of what's going to happen, not only with the ACA, but with healthcare in general. The first is that the ACA is still the law, okay? It's still the law. You still have to abide by the law. If you're an employer with more than 50 employees, you are still mandated to provide health insurance that is both affordable and meets actuarial value requirements. You're still required to do all of the annual ACA reporting, the taxes, all of the different aspects of the Affordable Care Act are absolutely still the law today, just as much as they were 3 weeks ago, and they will very much still be the law on January the 20th. So don't think that those are changing, at least not now. 2, be strategic in your decisions, not emotional. I mentioned earlier the call that we got from one employer specifically who called the day after the election and said, "Cancel everything. I'm done. I am not offering health insurance to my employees anymore." That was very much an emotional response, and I get it. Don't be emotional. Be strategic. Work with your advisors to think through a strategic plan that will help guide you through whatever changes might come, okay? And be nimble with that strategy, right? Be willing to be flexible. I mentioned earlier that 51 changes happened to the Affordable Care Act after its implementation. Over 51 changes, okay? So don't expect that things won't continue to change following whatever happens to the ACA in the next phase of healthcare. Issue number 3, recognize that your employees look to you, okay? Health insurance became a staple of an employee benefit program following World War II. And whether employers provide health care because they're mandated to, or maybe they do it because they want to create a culture where their employees have access to benefits, or whether they don't. And as an employer, you don't offer health insurance to your employees. Regardless, I will tell you that the majority of employees look to their employers for guidance in this area. So we tell people this all the time who don't offer health insurance to their employees. Even though you don't offer health insurance, you're going to still be looked to for health care. Okay? And what I mean by that is your employees are looking to you to guide them. And if something happened and they weren't insured, they would most likely come to you for a solution. Understand that as we move into this next phase of what happens to healthcare in the United States. Before the Affordable Care Act, there were laws. There were laws like ERISA and COBRA and various laws impacted by the Department of Labor and Centers for Medicaid and Medicare Services. Those laws are also in place. We've spent a lot of time and attention focusing on the Affordable Care Act, and rightly so. But the reality is, since 1976, multiple laws have impacted employers' approach to health insurance for decades. And those laws are still in the books, and it's not likely that those laws will go away. So don't forget that under the ACA, you're required to give model notices to your employees on whether you do or do not provide health care. That's a requirement, okay, every year, and where they can go to access an exchange. Centers for Medicaid and Medicare Services, if you do provide employer-sponsored health insurance, you're required to send Centers for Medicaid and Medicare Services notices both to CMS and to the employees each and every year. Make sure you're doing that. Most plans, especially fully insured plans in the United States, do not have a proper summary plan description in an ERISA wrap document. If you are with one of those big insurance companies, Blue Cross Blue Shield, Anthem, United, any of those companies, Those companies do not provide summary plan descriptions or ERISA wrap documents. Yet you as an employer are required to have one. There was a story of an employer in Texas about 3 years ago that the DOL knocked on their door and did a surprise audit and found out that this employer of about 16 employees provided health insurance, and they promptly requested a copy of their summary plan description or ERISA document. The employer said, well, I don't really know what that is, but here's a copy of my health insurance policy, and I can give you my broker's phone number. Now, we did not represent this client, fortunately, but that employer did not have a summary plan description because the insurance companies don't provide that. You actually have to have that drafted as an employer that offers health insurance to your employees, or dental insurance, or vision insurance, or any employee benefit program under ERISA. The DOL fined that 16 employer company $90,000 for not having that document and told them that they would be back in a few months to check again. So this law, this SPD and ERISA rule, has been on the books for almost 3 decades, yet most employers don't do it. And it's not because they don't want to do it or they don't realize or they're just intentionally not. It's because they don't know they need to. The health insurance market has done a great job for years of selling health insurance, and there are brokers that do a great job of selling health insurance. But there's so much more than placing health insurance if you're an employer doing so. So be aware. And then finally, every year employers of certain sizes are required to give COBRA notices to employees. Okay, so make sure you're doing that as well. So if you need help, there's a solution, and you're a member of ESA, and you have a number of solutions available to you. One of those is the new, and I'll call it the improved because now I'm part of it. So there's my plug. I'm joking if Merlin's on the call. That was a joke. But the ESA Insurance Solutions is an, we're really excited about the next phase of that. Security America Risk Retention Group has done a phenomenal job of creating an industry-specific E&O and GL program for ESA members, and we're really excited, we being GDP Advisors, to be the next part of the next phase of that, which is really trying to wrap together all of the different components of insurance that the various ESA members might need. Recognizing that ESA members are across all spectrums of both size and geographics and financials. And so our program as part of ESA Insurance Solution encompasses everything from health insurance for employers that have 10 or more enrolled, to workers' comp for any size employer, business auto insurance, property, all the different components that insurance that are insurance needs for employers. Those are all things that ESA Insurance Solutions now provides, and we being GDP are really excited to be part of that. And we hope that you will consider ESA Insurance Solutions regardless of what you're doing. You are a member, and as a member you get access to these benefits. So make sure you're taking advantage of that, or at least looking to see if it makes sense for you. With that, I'm going to take questions if there are any. Jillian, if you've got some that have come across maybe in type, I will kind of turn it back over to you to kind of run the Q&A session if there is any. Thank you for your time, everybody. I always, I am by all means an insurance and healthcare geek. This is what I do, and you allowing me to talk to you about it for 40 minutes just saved my wife 40 minutes when I get home of talking with her about it. So she thanks you as well.
Thank you, Seth. That was very informative. We'll now move on to the question and answer segment of the webinar. You can still submit your questions in the question window of your control panel, but let's see what we have here. Seth, can you tell us a bit more about the health plans offered through ESA Insurance Solutions that members can now access?
Yeah, that's a great question. So I mentioned earlier that the healthcare program that's available, the health insurance program that's available through ESA Insurance Solutions is specific to employers with 10 or more enrolled. Okay, and the reason is because just like every other insurance policy, underwriters have a threshold. And we hope that over time that number will continue to drop. But given that this is a new program for ESA, it is limited to those that have 10 or more people enrolled. The unique part of the ESA insurance program that I think that members will find very, very appealing is that I mentioned earlier that health insurance companies have to spend a certain amount of dollars on claims, or they have to effectively give you the money back, right? Well, insurance companies were really smart about that, following the passage of the Affordable Care Act, and what they did was they lobbied Washington to allow them to effectively use one company's money if another company ran bad, thus pooling the risk. So if you ran really well and ran better than 85 cents on the dollar in claims, you didn't probably get any money back because the insurance companies were allowed to use your gains to offset somebody else's losses. And that was part that was lobbied. That was one of the 51 changes that came in after the passage of the Affordable Care Act. So knowing that, the way that we structured ESA's health insurance program was that every month, members in the ESA program get a report of their claims utilization. And the fixed cost component of the program is about 40 cents on the dollar, with 30 to 40 cents, with 60 to 70 cents going into the claims fund. Okay. Now, I'm not going to get too much into the details, but claims don't get allocated back to members that are over a certain threshold. Long story short, if your fund doesn't run out of money, you get it back. If your fund, your claims portion, so if you give $1 and 30 cents goes to overhead and reinsurance and administration and all of that, and 70 cents goes to claims, you get 100% of that fund back at the end of the year. Last year, in a similar program to ESA, members were returned over $2 million of premiums back last year to another program that we run, very similar to the one with ESA. You have unlimited plan design options. You can pick whatever plans you want, structure them. There's PPOs. Deductibles can be whatever you want them to be. And our average renewal increases are less than 5% in all of our other programs with this same similar structure. So we're really excited about it, and that's really the way that this is structured.
Great. Now, can you talk a bit about how you're working with businesses to manage risk and protect them?
Yeah, it's a great question. So, one of the things that we looked at in the insurance market, and I'll give a quick plug to ESA Leadership Summit that's coming up, and I know that Jillian's going to talk about it here in a second too, but we're going to talk more in depth about this if you want to come to my session, but is that employers, regardless of your size, are faced with risk. Risk is a reality. Okay, I'm an employer, I own a firm, and we have risk. There are two types of risk, two categories of risks, insurable and uninsurable. Right? Insurable risks are fairly simple, right? They're easy to understand. I can buy an insurance policy that protects me from that risk. But what we find more often than not is that the downfall of companies has very little to do with insurable risk and has everything to do with uninsurable risks. I mentioned earlier the story of the employer here in Texas with 16 employees that was fined $90,000 for noncompliance. There is no insurance policy on the marketplace to protect you from noncompliance issues. And these are things that specific employer didn't even know. Okay? And so employee culture, what we call revenue risk, right? There are enormous risks that employers face each and every day that are uninsurable. And so our approach with all of our clients and all members of ESA that approach us is to address that risk in what we call it's actually our patented process, which is first we identify risks, and those are different in every organization. Then we quantify them. What's the value to that risk to my organization? And then thirdly, we prioritize them. Because if you know what your risks are, you can do something about it. Now, it doesn't mean we can always eliminate every risk, but the more that we know about it and the more we prioritize it, we can put plans and processes in place to manage it more effectively. And what's interesting enough is when you do this, not only does it reduce the overall risk to an organization, but it also improves that organization's insurance premiums most of the time, because insurance underwriters look at that organization as somebody that has their house in order. And so our process is to take each client through that identification, quantification, prioritization process each and every year to help them manage their risk more effectively.
Okay, we've got a long one here. The HHS designate Rep. Tom Price has indicated he has a plan to repeal and replace Obamacare, which may be the bill you mentioned that passed the House last year. His plan calls for tax credits, health savings accounts, and the ability to shop for insurance across state lines. Can you discuss how some of these proposals may impact the market and whether they are viable with or without insurance company support?
Yeah, that's a great question. So, you know, we'll see what Dr. Price, who soon to be Secretary Price, if he's does. Yes, he was very much involved in that bill that I mentioned earlier, and so a lot of those same components that you just mentioned in the question were in that bill as well. So let's kind of break those apart a little bit. Health savings accounts specifically. I'm a huge fan of health savings accounts. Full disclosure, I'm enrolled in one myself. It allows me to save in years that I don't have healthcare expenses rather than spend it in premium and roll over that money in a tax-free way for future expenses. So it also encourages consumerism. And so remember I mentioned the three legs of the healthcare system: the health insurance provider, the health claims payer, and then the actual user, you and me, right? Health savings accounts encourage you and me to be better consumers, because if it's my money in that account, I'm going to spend it wisely. I'm going to find out, hey, if this place over here has a $500 MRI and this place over here has a $1,500 MRI, I'm probably going to go over there and I'm going to get the $500 MRI. Okay, but we don't ask those questions right now. So health savings accounts encourage competition because they encourage shopping. They encourage you and me to be better consumers, and so that's one area that I think they could be very much be impactful, and I'm really excited about that extension. As far as competition amongst state lines, you know, this is one of those that listen. It sounds good and it's great. There aren't any insurance companies left to compete. Okay, you know, when I got into this market in 1999, there were 26 health insurance companies in the state of Texas. 26. There's 4 now. 4 fully insured health insurance companies in the state of Texas. And so those 4 are also in all other 50 states. So United Healthcare, Blue Cross, Cigna, Aetna, Humana, those companies, they're already in all the states. They're already competing across state lines. So now, does that mean that we couldn't have new insurance companies come, you know, more regional companies go into certain markets? Not at all. You know, the hurdle you get when you have insurance companies being able to sell insurance across state lines is you do lose a bit of state control. Okay, so again, regardless of whether you're a Republican or Democrat, if you are a Republican, typically you're in favor of states' rights and states' control and all of that. And so when you reduce the requirement of an insurer to compete across state lines, and you allow them to do that, you then have to have some regulatory body setting minimum standards, and that most likely would be the federal government, which our friends on the right have been vehemently opposed to. So I'll be interested to see how that one plays out. I was trying to think what the other one was. There were health savings accounts, cross state lines. Jillian, what was the third one?
Will the plans be viable with or without insurance company support?
Excellent question. You know, no, nothing is viable without insurance company support. The Affordable Care Act wasn't viable without insurance company support. Insurance companies were crying to the public, but behind closed doors giving high fives when the Affordable Care Act passed, because they were very much involved in the actual execution of it. So it's not viable without their support. It's likely that they'll get it. Because unfortunately, whether we like it or not, folks, Washington moves about as fast as molasses in Minnesota in December, and insurance companies are very much lobbying and involved up there. So I don't think that we will end up with anything that doesn't have health insurance industry's support.
And lastly, he wanted to talk through tax credits.
Talk through tax credits. That's a pretty broad question. So, you know, there are multiple credits that are available both to the individual and to small employers. The small business tax credit for offering health insurance in certain states through what's called the SHOP, and that is the exchange that small business employers can access. And those are employers that are under 50. There's really a broad spectrum. What I would encourage you, if you really want to dive into the various tax credits that are available, reach out, schedule a time one-on-one with us, because in an essence of time and really touching on all the topics of tax credits. I'm going to forgo that question and ask that we reach out. We'll give you some information here that allow you to reach out to us directly. We can discuss. I will say this, with the Affordable Care Act, it is propped up on tax credits, and the advantage of those tax credits is actually insurance companies, because the insurance companies can still set the premiums and they're reimbursed through tax credits that are given to those members. So if I'm under the federal poverty level, or at least 4 times the federal poverty level, I can get a tax credit on the exchange. That credit actually doesn't go to me, although it reports that it goes to me. It actually ends up in the insurance company's pocket, because all it does is reduce your premiums, and the insurance companies are setting those premiums. So it's an interesting side to the tax discussion.
I have one more here, and it's more of a statement than a question from Stephanie Stanton, which I thought was very interesting. Thank you very much for such an informative webinar. I don't have a question at this point. This type of information should be required in high school and college curriculums. I agree we should become better consumers, and access to this information definitely helps.
That is a great closing statement to what we've talked about today. So thank you, Stephanie. Appreciate that.
So I just want to thank you, Seth, and thank you everybody for joining us. You can learn more by visiting our new ESA Insurance Solution website at insurance.esaweb.org or securityamericarrg.com. If you enjoyed Seth's presentation, be sure to join him along with other high-profile experts, both in and out of the security industry, speaking at the 2017 ESA Leadership Summit, February 12 through 15 in Tampa, Florida. Not all events are created equal, and this conference, designed by and for the industry, is a unique opportunity to expose you to new ways of thinking about your business and how to run it most efficiently. Investing just a few days at the Leadership Summit will enable you to take a step back from the day-to-day operations of your company and allow you to spend some time thinking about the strategic direction of your organization, your business goals, and how to get there. Registration prices increase December 30th, so get over to esa-summit.com and get your team's registration secured today. We certainly hope to see you in Tampa. Thank you, Seth. Thank you, everybody, and have a great afternoon.
Thank you.